Good evening, everyone, and thank you for joining us. I am Nicole Dozier, Director of the Health Advocacy Project at the North Carolina Justice Center. Our mission is to work ourselves out of these jobs by attacking poverty at its roots and eliminating it. Through a number of issues, using a variety of strategies is the way in which we do our work. I'm joined today by our health advocacy team members, Hun, Rebecca, and Will. Our team hopes that in these times that you are safe and well, but we also want to acknowledge that too many North Carolinians live daily with stress and without peace of mind because too many policies just don't work for them. From mountains to sea, we see this. The Justice Center's role, though, during this health crisis is to work collaboratively across our work issues with partners, both traditional and less traditional messengers, but especially with people who have been directly impacted long before COVID-19. They have been intentionally and historically impacted by systems of inequality and inequity, by natural disasters that hit them harder, and by harmful, intentional, inefficient policymaking. We hope that you will stay in touch with us and that you will learn more about the work that we do and the people and the reason why we do the work we do, and that you will work alongside us and with public officials who really care to do what's right for people to help craft the right response, an urgent one in this moment that will build a better, more equitable North Carolina for us all. So thank you.
Hey everyone, I'm Rebecca Sturries. I'm the Health Engagement Coordinator for the Health Advocacy Project at the North Carolina Justice Center. Just a few housekeeping things. We definitely want this to be interactive with questions. After each presenter goes, we will then be asking questions. You can enter questions at any time in the GoToWebinar control panel that each of you will have. There's a question box. You enter that and I will then ask the question when the proper time comes. So we'll have each presenter and then right after that presenter, there'll be question and answer. So feel free to put something in the question box and then I will ask those questions. Again, thank you so much for joining us.
Thank you, Rebecca. So first up, we have North Carolina House Representative Carla Cunningham, serving the 106th district since 2012. So Representative Carla Cunningham is also the co-chair of the House COVID-19 Healthcare Committee, and we just are pleased to have you join us. While she's speaking, be thinking of questions you may have for her, and remember to enter any of those questions into the chat, and Rebecca will walk us through those questions. Representative Cunningham?
First of all, thank you all for doing this. I really appreciate the opportunity to be public with some of the information that sometimes a lot of individuals are unaware of because of what they're doing, especially during this difficult time, especially for essential workers who are probably not watching what government entities are doing, but looking for the impacts of what government can do to assist in the crisis. One of the things that you all wanted to know was the formulation of the creation of the COVID-19 healthcare committees. And there were several committees created. They were only created on the House side by Speaker Moore. And of course, I'm serving on the healthcare committee. And that healthcare committee is bipartisan. It has 2 Democrats and 3 Republicans on it, and 4 out of that 5 who are co-chairing has some direct affiliation with healthcare. So you have myself as a longtime nurse, Donnie Lambert, who is out of Forsyth County, used to be a hospital administrator, and you have Josh Dobson, who used to be an emergency medical technician, and Donna White, who used to be a public health nurse who worked for the Department of Health and Human Services for some time. And then you have Becky Carney, who I don't believe Becky Carney has any health background, but she's certainly been impacted by certain disease processes. So that group of individuals are heading the health committee, and also it's one of the smallest committees. I don't know why that is, but it seems like the smaller it is, the more work or accomplishments you can get done instead of dealing with 120 people or 50 people. So I think we're very focused. The charge that we were given, and I'll have to read them because I can't say them, you know, by my mind. The first charge that we was given was to document and anticipated economic impacts associated with the spread of COVID-19 on North Carolina's economy, including the workforce, dislocation, healthcare resources, and the decline in consumer activity and temporary industry contraction. The second one was to measure the necessary to provide economic and regulatory relief to the individuals, business owners, institutions that were directly impacted by COVID-19. And then the third one was existing authorities, procedures, policies, and resources dedicated to mitigating the spread of COVID-19. The fourth one was legislative actions to more effectively address anticipated economic contraction on the healthcare system costs and the capacity challenges, as well as future pandemic threats to the citizens of North Carolina. And the fifth one was the measure to necessary to maintain the essential functions of North Carolina government during a pandemic, including our education and election system. So what we have been doing, of course, the first people that came to present was the North Carolina Medical Society and the North Carolina Hospital Association. So they on the front lines, and so they really was demanding that we go in a shelter in place before the governor took that initiative. And they knew the in and outs of how many respirators the hospital have, how many ICU beds they need, how are they looking on protective personal equipment. They had those numbers, as well as the medical society concerned about the status of healthcare workforce and the first responders. So they already were ahead a little bit on what we should be doing to do the mitigation. And everybody know what mitigation is. You know, the mitigation is what we're doing right now, the social distancing and the staying in place. So everybody knows what that is by now. They're just using the word mitigation to slow the spread of the disease so it doesn't overwhelm our healthcare system. So you can imagine they had those concerns. So as we move forward this coming week, we will hear people on the front lines for childcare. We will also hear from the epidemiologists on modeling, and there are several models out there, and those models look at our state and compare to other states, and they also compare to other countries, comparing to the United States, and they look at when they think that we should plateau. And what it is the curve is going like this. As people get sicker, it goes higher and higher, and then it should start leveling off. And so they're trying to keep abreast of that, because that can help determine our necessary needs for healthcare workforce, as well as additional beds or places for people to have when they become seriously ill, because we only have so many intensive care beds. And you know, it take more than one person to run a respirator or ventilator. You have to have respiratory therapists, lab people. It takes a whole team when a person goes on a ventilator or a respirator. So that's what we'll be doing, is looking at child care. We'll also be looking at the aging population as well, because as you all may know, that several nursing homes and assisted living facilities in North Carolina have also had outbreaks. So that's next for us to be looking at, is that population, because a lot of that does fall up on our purview to be monitoring and taking care of those locations and those, you know, people that are residing in those as their residents. So those are two important things that we're going to take a look at, in addition to looking at first responders as far as firefighters, police, EMTs, because as you've seen in New York, they have 20% of their workforce that are police officers that are currently out because they have been infected by the virus. And I don't expect to see anything different unless we do much better with our mitigating and following the directions of shelter in place. So that's basically what I have. And I'm ready when you all are.
Thank you so much, Representative Cunningham. I'll turn it over to Rebecca now to see if there are questions.
There are not any questions as of yet, but wanted to go to a question that we were sent earlier, which was about the social workers and who are doing these visits to families, and actually anyone that's doing that sort of essential work. We keep hearing about shortages of PPE and that sort of thing. So one of the questions is what's being done to make sure that like social workers and folks like that are able to get the protective gear that they need.
So the guidelines are present. You have to go to the Department of Health and Human Services website and look up on the Child Protective Services, and we do have guidelines that are set up. In the situations where face-to-face is necessary, those remain critical, and they're advising people to protect themselves. Normally, those are ran by protective services, are ran by the local department. So if they're not having accessibility to PPE, they are referred to contact the emergency medical services in that emergency management services in our local area, and they're supposed to connect them with if they need PPE or other items. Other than that, the guidelines are present on the Department of Health and Human Services for individuals to protect themselves. And it also has some additional guidance for telepsychiatry to use the telehealth as an alternative that are not in a non-emergency situation. So those are there.
Wonderful. We have two questions about people who are in prison or jail. So what about the prison jail vulnerable population? And then beyond that, what is being done about the many minors who are being held in county jails and tight confines and who would have been there for a long time awaiting court dates?
Well, let me respond this way. As most people probably don't know, is that the Sheriff's Department is independent. We do not have that much guidance over the Sheriff's Department. They are actually make some of their own decisions on how they handle things, even though we're still under a protective situation with the virus. They still have their own guidance, and they have their own procedures in place that they're doing. The only thing that I've heard concerns about in the prison system, we didn't have any cases a while back, but now we have Butner, which has numerous cases inside of it. And I don't know if people really think about that with prisoners within the correctional system, while they're in prison, they have health care, but once they exit the system, they have no availability to health care. So that's another thing that I think that the correctional institutions at the state level are concerned about, is releasing individuals that are infected and they don't have accessibility to care and they're out in the community. Oftentimes they can be infecting other people. Not to say that's the solution, but we do know within the confines of the penitentiary or correctional institution, they have nurses, they have the medical accessibilities to take care of them while they're there. But once they leave, they don't qualify for any Medicaid, and they barely, if they can get a job, in most cases, they can't afford, health insurance.
So if people have concerns, do you think that they should just contact their local sheriff departments if they are concerned about this? Is that sort of, or the DA?
I would contact my sheriff's department. We receive an update from the Sheriff's Association almost every week, but that's just an email that they send to let us know what's going on, but their guidance is within the confines of their walls. We can, at the state level, the governor can institute certain things, but as far as the legislature, the Sheriff's Association has a lot of independence.
Wonderful, thank you. So there's been a lot of concerns with cafeteria workers and educators still working in the schools that are not a feeder school for students. How do they protect themselves? And is each county doing their own thing, or is there like statewide guidance?
There is some statewide guidance on the Department of Health and Human Services website, but in most cases, the independent school systems are pretty much managing the protection that the essential workers should be using for themselves. So that sort of goes across different school districts and what they're doing.
Okay. So glad to hear Representative Cunningham mention education and election security as priorities for the COVID-19 response. Can you speak more about what is being considered to make sure upcoming elections are secure? And Representative Cunningham, you sort of keep cutting out a little bit, so if you could just sort of just lean in a little bit more, hopefully that will help. Thank you.
Okay, maybe I'm not talking loud enough. Okay.
That's good. Thank you.
So you wanted to know about what now?
Sure. It was, could you speak more about what is being considered to make sure our upcoming elections are secure?
Okay, well, that entirely is not addressed by the committee that I'm serving on, but there have been some public comments, public recommendations that we move to mail, which we have wanted for quite a while, but this is definitely the situation that we should be pushing for, because as you can see yesterday, people went to the polls out in Wisconsin scared to death, and we will be coming up for elections. We should have a good window of time that some of this legislation can be done, and it is my hope that we do move forward with doing some type of mail absentee ballot push. We probably can do that now without having legislation, but it definitely would be much better if we would put something in legislation that would go ahead and set up towards the coming election, the next election, that we could go ahead and do absentee and mail-in ballots across the entire state.
Wonderful. Are there other mitigating measures besides extending the stay-at-home order that are being considered to continue flattening the curve through the end of May?
Not that I know of. The only one that I see right now, you know, we have all the other things we need to be doing. Washing our hands is very important. When we cough, when we sneeze, cover our mouth, stay to 6 feet away from other individuals. We know those things, and we should continue to do those all the way through. And even if you're living in a house where someone is sick, I've noticed that, like, if you've been exposed, you separate yourself. Maybe you need to move in the garage or temporarily. But those are the major things, the social distancing and us sheltering in place, because that causes less social interaction by being out in the air, roaming around with individuals that may be infected, because we don't know if we're infected or if they're infected, because some people are asymptomatic, meaning they don't have symptoms, but they've been infected by the virus. So we need to keep doing what we're doing as far as mitigation, the social distancing and shelter in place as much as we can, and leave the essential workers the opportunity to do what they need to do, especially as far as our first responders and our health care, because we don't want our healthcare providers to become sick and then no one available to take care of you when you get sick, or your family when they get sick. And we're already seeing that happen in New York, in Milwaukee, in Louisiana. We're seeing that happen all across the country now, that healthcare workers are getting sick and they are dying. I was reading something a couple of weeks ago of the stress level of seeing death at that level, that now some of the nurses and some of the healthcare providers are committing suicide because it has become such an emotional toll on them. No one's ever seen this kind of death in this 100-year period that we've been in since the Spanish flu, excuse me. No one's seen that level. Even with AIDS, it wasn't at that level that we saw death. But this is way beyond. You know, I've never seen the type of death that we're having now. So it's taking a toll on them.
Thank you. Okay, looking from the economic perspective that you spoke about, I saw that the governor released his executive order establishing a payment freeze on utilities for 60 days. Is there anything addressing a possible payment freeze for tenants living in rental facilities, apartment rent payment freezes. Thank you for your service and leadership.
Well, we do have in place where there won't be any evictions done within 60 days. So that's a help, but we don't know how much longer this will extend out. We're assuming that we may peak, we may plateau, and may start to turn the clock around to go back to what normalcy is. I don't know if that's going to be true. And if that is not true, then there's going to be some additional assistance needed. And the state coffers are going to be very, very low. So that's going to require some additional federal stimulus money to assist, because we're going to be drained.
Wonderful. Thank you. Okay. Will there be more initiatives for more county testing that some form of financial assistance can be offered by the states? Initiatives. Will there be more initiatives for more county testing?
You mean county testing?
Yeah.
The COVID testing.
Yeah. The COVID testing, I guess maybe they were asking about municipal, but yes, are there more initiatives for more testing than what's currently happening now?
I believe it is. It was a new site started up here in Mecklenburg County where they can test for the antibody, and they can have those results within 15 minutes. But the thing about it is we haven't been able to test on a large scale that could really give us a full picture and give us accurate data. We haven't been able to do that because they weren't available. Even they were running out of the swabs to swab your nose and your throat with. So now we're not in, our priority right now is not in the testing phase. Our priority right now is mitigation. I believe after mitigation phase is over and the demand on healthcare and first responders come down, then we will probably move into another testing phase, because the expectation, according to the epidemiologists, is that when the fall rolls back around, you're going to have people that were exposed and have the antibody, and then you're going to also have an overlap of the flu and the COVID going on at the same time. So I think after mitigation, after we see what happens with the peak, then we can move back to testing, because the demand on the healthcare is just going to be tremendous once we peak, and just such a demand that it's going to be unbelievable.
Thank you. What is being done to guarantee housing for the houseless and homeless population?
Well, I just heard an initiative today that some money was going to be coming from the federal into the states that would look at housing some of the homeless people, and even housing some of the people that have tested positive for COVID, that they would be able to use hotels and other facilities that are not being used right now to do housing for them, so they're not in congregate settings, which would be great, because that way you wouldn't have those individuals infecting other people, and you also wouldn't have a large number of people in the same space where you're unable to do social distancing.
And so the idea would be that that federal money would go to organizations that are already doing this work?
I have no idea how it would come in, but I'm thinking that it would come in through the state and come in through the counties. That's how I'm seeing it, or possibly come direct to the cities.
Wonderful, thank you. Do we know about children taking from parents at the southern U.S. border? They are being widely placed often in for-profit facilities, such as the one outed by WRAL in Robeson County.
I have no idea about that. I have not engaged on that level of those individuals or looked at that. I'm pretty much staying in my lane.
Wonderful, thank you. Let's see. Let me just, okay, there's a couple more questions. Okay, there are many people who have applied for unemployment. We'll actually get to the unemployment question in a little bit. Let me see if there's any other legislative questions. Just give me 1 second.
I was going to ask you, am I the only one going to answer some questions?
Right, no, these are just the legislative. And in fact, let's see, okay. In fact, that's a good point. Why don't we move on to Dr. Watkins, Nicole, and then we'll go back to questions.
Sure.
Thank you.
Thank you, Representative Cunningham, and thank you, Rebecca. So up next, we have Dr. Richard Watkins. Dr. Watkins is a microbiologist and immunologist with a specialty in virology. So we're excited to hear from him and to have him answer some questions as well. Dr. Watkins.
Hey, thank you all so much for having me. Hopefully everyone is doing well. Can you hear me okay?
We can hear you, but for some reason I can no longer see you.
You can't see me?
No.
Huh, 1 second here.
Okay.
I can see myself. Can you see me now?
We can see you. Thanks, Richard.
No problem, no problem. So I'll just give a brief run through and then I'll be happy to answer any questions that you may have to the best of my ability. So what we have is COVID-19, which stands for coronavirus infectious disease 2019. It's a member of a family of viruses known as coronaviruses. There are a lot of transmission events that happen around the world regarding viruses, and this is one of them. And so emerging viruses always pose a significant threat to human health and organism health globally. And we've always had to do battle with infections, and a lot of virologists and epidemiologists have been warning us that we should be on the lookout for a huge pandemic. And one has come around. And from what I am aware of, no one has ever seen anything like this. So it started in the Wuhan province of China, or Wuhan city of China, but since then it has spread to virtually everywhere. These are just a few numbers updated today from the World Health Organization. There are 1,282,931 confirmed cases globally, with 72,774 deaths. There are 211 countries that are affected by COVID-19. In the US, and these numbers come from the CDC, Centers for Disease Control, updated today. There have been 374,329 confirmed cases and 12,064 deaths. And all 50 states have been affected. Specifically, right here in North Carolina, updated by the North Carolina Department of Health and Human Services, updated today, there were 3,221 confirmed cases, 46 deaths. There's a little bit more information here. I think this is really interesting. 41,082 completed tests. So we've got our number as far as what we've been able to do as far as the Department of Health and Human Services goes, as far as tests. And 90 counties in North Carolina have been affected, and that's reporting done by the Department of Health and Human Services. And some questions that people ask: who is at risk? Let me be very brief with that. Everyone is at risk. Some people might ask, who is most vulnerable? I would say our vulnerable populations in general are more vulnerable to a disease like this, but more specifically, your frontline healthcare workers who are dealing with potentially COVID-infected patients or patients infected with COVID on a daily basis. Those people are going to receive the brunt of infections because they're putting themselves at direct risk every single day, which is why social distancing is so important. In a nutshell, social distancing basically just means stay at home as much as possible. because one, everybody can be infected. Two, we don't know who's infected. And thirdly, people who get it, who have a compromised immune system, which is basically the system of your body that keeps you healthy, that basically clears infections normally. If those people have a compromised immune system, then they could experience a very severe case of COVID infection, leading to death. And we just saw those numbers. They're extraordinarily high in such a very short period of time. I hear questions such as, if I have to go out, what should I wear? And I will go back to the social distancing and say, if you don't have to go out, do not go out. But if you do have to go out, oftentimes it is a great idea if you have it. Now, this is going to sound a little bit like mixed messaging. So a respiratory mask is, really important. Anything that will prevent, aerosolized particles from people talking, from people breathing, coughing or sneezing, from getting into your mouth or into your nose will be useful. And so respiratory masks certainly stop those particles from being inhaled by you. But they can also get in your eyes, which is why personal protective equipment also includes eye safety equipment. But the reason why I say there's a little bit of mixed messaging, because while it is true that it is good to have a respiratory mask to protect you from airborne diseases or diseases that find themselves adhered to a surface, is that our frontline medical workers need those pieces of equipment. And so people going out and purchasing this equipment will make it a little bit harder from our frontline medical care providers to have that equipment for themselves. So it's a little bit of a catch-22, and it's really why we need equipment ramped up as far as production nationwide. Another question that I hear is, what kind of mask will keep us safe? I am not an expert on personal protective equipment or respiratory masks, but a vast majority of masks come from the company 3M. And you can buy 3M products all over the place, from painter's tape to respiratory masks to safety goggles. And on their packaging, it tells you what particular mask will protect you from and what you should use these pieces of equipment for. Most pieces of personal protective equipment, or PPE, gives you instructions about what that particular piece is meant to protect you from. So if you're thinking about purchasing it or you have questions regarding that, feel free to check out those companies' websites or any of the instructional material that accompanies those pieces of equipment. If you can just cover up your mouth, if you do not have a respiratory mask, a lot of people, will cover their mouth up with a bandana. That is not optimal, but the barrier of, putting something over your mouth to protect you from, things getting in your mouth is useful. But the number one thing is to stay inside if you can. A lot of people are asking about the anti-malaria drug, and does it work? There was some reporting coming out of a research group which looked at the combination of a antibiotic, anti-inflammatory, and also a anti-malaria drug in combination. And they saw, viral loads drop a little bit, although patients still had symptoms. And I think that was grasped onto. Right now, there is no specific therapy for COVID-19. And there's also not a vaccine available right now for COVID-19. Another thing is, if you're starting to feel sick with COVID-19, what is the process? If you're feeling sick and you think you might have COVID-19, the CDC website has some terrific information about what they're advising people to do if they feel sick, and regarding testing. So you should watch your symptoms. And if you start having flu-like symptoms such as aching, difficulty breathing, fever, and these symptoms won't break, you may want to consider isolating yourself if you're already sheltering in place, if you have family members not showing these symptoms. Now, you will still run the risk of infecting family members. You know, if you're in a house, close proximity, it's going to be really hard to make sure, you know, you don't contaminate other areas, but you must try in order to make sure other family members don't get sick. Now, if you start seeing these symptoms get more severe and you cannot breathe, then you have to go in and seek medical treatment. And then at that point, the physician or a worker for the Department of Health and Human Services can provide you with a test. That is how testing is generally done, through your healthcare provider or the Department of Health and Human Services. What should somebody do if they don't live near a medical facility? Well, if there are any kind of, tele-based healthcare providers, then that is what you can do. But I will say that if you are having difficulty breathing and the symptoms are getting severe, then you are going to have to get medical treatment as soon as possible. And that's just a fact. Will there be a surge? The Surgeon General recently said that this week for Americans is going to be very difficult, comparing it to 9/11 and our Pearl Harbor. That kind of gives you a little bit of insight into how our health experts are viewing what lies just beyond the horizon. And then the next question is, when will it be over? We don't know when it will be over. We don't know how seasons will impact COVID-19. We don't know. Tony Fauci, recently was answering a question regarding when can we go back to normal, and a bit of that sounded a little bit like, we may never go back to normal, and emerging viruses becoming kind of problems that we just have to deal with. It's just throughout all the pages of human history, from HIV to influenza. These emerging viruses have come in and have taken root, and we have to deal with them. Even if a vaccine does come online, it at best will take a year, and then we have to make sure people take the vaccine. So I'm not quite sure when we're going to when will this be over, but we could always be dealing with this in some way, fashion, or form. I'd be happy to answer any questions. That was just a brief run through.
Okay.
Thank you so much, Dr. Watkins. And Rebecca?
Okay, so we have, what do we use and what do we avoid for fever? There's some information out there that some anti-inflammatories may put anyone at risk. Is there any truth to that?
Yeah, so I have heard a little bit about that. I think the best thing to do when trying to figure out what you should take as far as dealing with a fever, if you have the opportunity to contact your healthcare provider, that should always inform what treatment you should do for yourself. So that would be my very first suggestion, is to contact your healthcare provider if you have that capacity, and then do that. But I have heard things about some anti-inflammatory drugs have shown side effects that were unintended, but the specifics of those I am not knowledgeable of at this moment. But I would go back to say that if you're trying to think about what you should do to control a fever, you should definitely contact your healthcare provider.
Wonderful, thank you. Did you talk about the drug that the president is talking about? Can you talk a little bit about that?
Yeah, so I mentioned it a little bit earlier, and there was a little bit of preliminary data that had came out regarding patients that were treated. I think the group was French, and what they showed in their small sample size was that viral loads dropped a little bit for patients that had COVID. but a lot of patients who received the treatment still had symptoms. So will this be beneficial? The verdict is still out. At this point, we're just trying to figure out anything that can work in the absence of a virus. I mean, keep in mind, right now, we don't have anything. So I think that's a little bit of why we're trying to look into this drug that right now the data supporting its effectiveness on COVID-19 could be improved upon.
Great. Is it reasonable to think that by the fall of 2021 or 22, we will be able to manage COVID-19 the way we manage the flu or H1N1?
I don't know. I don't know. So part of it is, managing it, and how I think the working definition of manage from this question is, how we treat the influenza. And so we do have, Tamiflu, which is a therapy which directly impairs influenza's ability to do certain viral things. But we also have vaccines that we roll out for seasonal flus. So we have those two things, and we have right now neither one of those things for COVID-19, and it's hard to imagine when we will have those two things. It's very unlikely that we'll have a vaccine by the fall. The WHO reports that 2 vaccine candidates are going through clinical trials. And that process is, of course, being, worked on feverishly by researchers around the globe, throughout the United States. But it's probably unlikely that we'll have a vaccine by the fall. And without a vaccine, controlling it like we can control influenza will be unlikely. And I would also like to say that we don't necessarily control influenza. Influenza is something that we have a vaccine for, and we can't get everyone to get vaccinated. And so every single year we have to deal with influenza because we don't have enough people getting vaccinated for something that we have a vaccine for. So who knows how long it will take for us to get a grasp of COVID-19.
If you get COVID-19 and recover, will you be able to get the virus again? How long will you have to stay in isolation until you are not able to pass the disease on? Do you have answers to those?
Yeah, so it varies. So with COVID-19, as far as symptoms or how long you're infectious, it varies dramatically. So that there is a large window of time from when you're infected, then when you show symptoms. And then the time in which you have to deal with symptoms are pretty long. And so there are a lot of suggestions out there that say that people can be infectious with COVID-19 for roughly 2 weeks after they recover or not having symptoms at all. But it varies from person to person. Now, your next question was about antibodies. So generally speaking, regarding viral infections, the body develops antibodies. In fact, as mentioned by Representative Cunningham, we are rolling out new ways of testing that are not based on a method called PCR. We're using antibodies more so now. So if a person is infected, you'll be able to look at the antibodies present. And if you see that you have antibodies present specific for COVID-19, then you can then make the determination that that person has COVID-19. Your next question is, will those antibodies then go on to protect the person from secondary exposures with COVID-19? And the verdict is still out on that. We don't know how effective that they'll be at neutralizing secondary infections of COVID-19, or if that is the case, and we do have protective antibodies, how long will those antibodies last? So it's still very gray in regards to that. But we do produce antibodies to infections all the time. And that's how vaccines work, is that you'll start producing an antibody response that will protect you. So right now we're still trying to figure out the immunological response to coronavirus infections that will help guide us in determining our approaches as the days go by.
Thank you
Hope
so
that
much.
answered the question.
Thank you, Richard. We can, there's a few others, but let's just move on, Nicole, and we can come back.
Sure. Thank you so much, Dr. Watkins and Rebecca. Next up, we have Dr. Katrina Kuzyszyn. Is that right, Dr. Katrina?
Musician like musician.
All right, Kuzyszyn-Jones, a forensic and clinical psychologist. Thank you for joining us, Dr. Katrina. Welcome.
I'm going to spend just a few minutes talking about some of the common questions that I've gotten in practice so far and things that kind of everybody is experiencing, and then have time for questions. So first, I'd like to say that this is a time period that's difficult for everybody. Ambiguity is hard for everybody. We need to show compassion towards ourselves and towards other people and what we're experiencing, and kind of give each other the benefit of the doubt if you feel like you're struggling or if somebody else in your household is struggling. And most of us are experiencing right now some difficulty with our thinking, with our feelings, and then figuring out how to cope with everything that is going on. So one of the things that we might be experiencing, or that you might be experiencing, I'm certainly experiencing some of these things, are feeling of lack of control, and lack of control over our movement, lack of control over our decision making, or feeling indecisive about things, lack of control over our finances and our work situations, and lack of control if you have children in the home with what your information you're getting or not getting from the school system. Having difficulty concentrating right now is really normal and common, and is probably amplified for most of us because we're all trying to multitask. We know that multitasking isn't something that we're actually good at, even though we all try to do it all of the time. It limits our productivity, it increases our impulsivity. We don't pay attention to, the thing that we think we're supposed to be paying attention to, because we're really paying attention to the other thing. So this is an important time to be mindful of trying to do one thing at a time. Many of us are experiencing grief and sadness and loss for any number of reasons, whether it's work related or lack of connection with other people, anxiety and worry about what's happening now, what's going to happen in the future. What does this mean in the moment? We're fearful about our health. We're fearful about our communities. We're fearful about our own financial solvency. A lot of people are feeling irritable, whether that's because there are outside forces that we don't have control over and we are feeling irritable about that, or starting to feel a little bit stir crazy, cooped up at home with a bunch of people who we supposedly love most of the time, but we're just getting on each other's nerves easier and more easily because we aren't getting a break from each other. And then having some physical symptoms of anxiety, of depression, feeling tightness related to tension, not feeling like we can have the movement that we want to have. And there are some people who aren't experiencing this as that big of a change. If you already work from home, if you don't have kids at home, it might not feel like it's that much strain on you. The thing I would say is, one, that's great. Two, don't be surprised. Don't find it totally unexpected if something 2 months from now you start to feel some of these things. It doesn't necessarily mean that there's anything wrong, but oftentimes people can do a really good job coping in the moment and kind of, feel like you're keeping it together and going through the motions of everyday life. And then when things actually get back to normal, you feel the aftershocks, and that might be in a physical way or it might be in an emotional way. So some of the things that you can do to help cope and get through this time period are really thinking about where you're getting your information in order to make the right decisions, right? Listening to the CDC, listening to your state and your local government agencies and the information we're getting from our local hospitals, rather than going online and finding your information from a non-reputable, source like Facebook, with what people are posting about what they think that they are reading or what they understand. Really thinking about also how much screen time you have. It's important for us to be informed and to watch the news. And it's important for us to stay connected through social media, because right now, for a lot of us, that's all we have. But really be thoughtful about how much anxiety is it creating. If you find yourself watching the news and feeling really panicky and worried afterwards, then maybe you really need to limit it to once a day. If you can't tolerate that idea, twice a day, right? But also think about, if you're on social media, how are you going to balance what you're getting from news media and social media so that you're not getting overwhelmed with all of the information. Also thinking about not looking at stuff right before bedtime, because that's when people tend to have a harder time falling asleep, right? If we're feeling anxious because of something that we've seen on social media, or we've heard about a family member or friend who's gotten sick, having that information running around in your head when you're trying to sleep is going to be a problem. Thinking about how you want to help cope in this time period. If you are using social media, using it as a point of connection versus contention. I've seen a number of posts where people are, kind of rightly so, feeling irritated about how they think some people are not handling the situation well. But having an opportunity to kind of vent is helpful, but thinking about who else is reading it and how that is coming across, and are you actually fully informed? It's easy to kind of spout off, and so just being really thoughtful about how you're using your social media influence in that way. Keeping your normal routines, your normal things that help you cope, intact, your self-care and your habits kind of as normal as possible. Even though you might not be going to work at the kind of normal time if you're working from home, or maybe now you have more shift, especially if you're a healthcare worker, or a weird shift that you're working. So really thinking about how you want to make sure you're sleeping your 6 to 8 hours, preferably 7 to 8 hours a night. Also thinking, if you have children in the home, about how you're making sure that they are getting enough sleep, even if they're begging to stay up later than they normally would, and they say they'll sleep in the next morning, right? You want to just keep that routine in place as much as possible. Same with eating, being thoughtful about what you're putting into your body. If you, have a craving and you want to do Friday night brownies, don't feel bad about it, but really being thoughtful that sugar makes us feel worse, fat makes us feel worse, healthy foods help us feel better emotionally as well. Getting exercise, getting outside in nature is really important. Getting that, sunshine feel, and having trees and plants around us is really important for our mental health and our well-being. Doing things that are fun, having your hobbies, try something new. Have you always wanted to try that puzzle that's been in the closet for 3 years? That type of thing. And also being thoughtful about how to set boundaries for your workplace, for your children's schedule with school, and for your own alone time. Even if you aren't the type who feels like you need a lot of alone time, this is the time where you're going to feel probably the most stressed, in the sense of not having space, right? Because even if you have a great relationship with your family, being there on top of each other all of the time and not getting a break is going to wear on people. It just is. It's very normal. So giving yourself space, maybe you go take a bath, maybe you just lock yourself in the closet and read a book, right? You take a walk, take the dog out by yourself, but really being thoughtful about giving yourself that time. And remembering your kids need that time too. And they need, if you have multiples, they need time separate and apart from each other. It's helpful to have multiples playing together, but they also need to take a break from one another. Having flexibility and acceptance of this is the way things are going to be. Spending a lot of emotional energy on kind of wishing it were different is usually not helpful. Really being able to, you know, kind of proverbially look yourself in the mirror and say, is this worry thinking helpful to me in the moment? If you're being thoughtful, yes, I need to wear a mask because I'm worried about COVID, that's one thing, right? If you go on like a hamster wheel of worry about what's going to happen 3 years from now when we have no idea, that's probably not helpful and is just going to create more anxiety that you can't really do anything about. And that's where the acceptance piece comes in. And one other thing I'd really like to say is that this is a time, again, of stress for everybody. And it's really important to think about what either pre-existing conditions there are in your home, in your family who's not living with you, and with your neighbors, and really paying attention to, is there, you know, somebody who's struggled with drugs or alcohol use? This could be the thing that would preempt a relapse, and being thoughtful about sticking to any plan that they have. Depression and anxiety could increase during this time period. Relationship strain could lead to acts of domestic violence or child abuse. We want to be thoughtful about how we're going to maintain our own tempers and irritability and walk away, but also think about, what do you notice that you're either hearing or that you're seeing going on around you, right? So you might be on the phone with somebody and you hear something in the background that worries you, or you might see something across the street at a neighbor's. This isn't the time to kind of keep it to yourself and to stay out of people's business. This is really the time to be assertive and to be helpful, even if it's that you feel like you need to call 911 because you're really worried that that neighbor isn't going to do that. There are still resources available. Therapists are doing telehealth. Insurance companies are paying for it. We can do phone calls. We can do, you know, telehealth video chats. Other professionals are available. Attorneys are available. You know, depending on the county that you're in, there's different resources for domestic violence. There's social services. There's, you know, don't forget that there are financial advisors out there, that there are people who are available. Just because we can't walk into somebody's door right now doesn't mean that they're not available to us. So one of the things that I have on the slides are different resources that people can look at later, and that you can think about if there's something you need to pass along to, you know, a family member or a friend as well.
Thank you so much. Wanted to see if you have any questions. Rebecca, do you see any questions for Dr. Kuzyszyn-Jones?
I did see one, and now I'm trying to find it. It was about resources for young folks. Let me see if I can find it. I thought I had put okay.
I can try to help as well.
Okay, we have many students going through severe depression because of this pandemic and the fact that there is social distancing. What resources are there for our children that we can refer the families to?
So my understanding is that all of the hospitals are ready, right, and kind of waiting. WakeMed, UNC, and Duke all have child and adolescent services. Outpatient services in a lot of places are being done via telehealth, but every county has a crisis hotline that you can call. Every hospital has availability. You can find out, all you have to do is call their main line and you will get the information that you need. And if it's a real emergency, you should call 911 and they will make sure that you get connected with the right service.
Hey, thanks. I think that was all, and for Dr. Katrina.
All right. Thank you so much, Dr. Katrina. Thank you, Rebecca. Now we're going to move into Dr. Willman, Health Policy Analyst with our team. Will? Are you unmuted, Will?
Good evening. Can everyone hear me?
Yeah. I don't
Great.
know if we can see you. I don't see you, but it might be mine.
Let's share this webcam here. There we
There you
go.
go.
Good evening, everyone. I'm going to move quickly through my slides, and thank you so much, Dr. Katrina. That was some great advice. I have 3 little ones at home, and sometimes I feel like, woo, this, it's all, yeah. So anyway, but thank you for that wonderful advice. I'm going to talk about 2 policy issues related to COVID-19, race equity impacts, as well as unemployment, and I'll just get right into it. As we are seeing, there are some pretty dire statistics coming out with regard to COVID infections in several states. And so, as you see here on the screen, Michigan has about a population of 14% African American. However, 33% of the cases there, COVID cases in Michigan, are made up of African Americans, and 41% of the deaths are from African Americans in Michigan. So certainly overrepresented there. Next slide. Illinois, same type of picture, 15% African American population. However, 29% of the cases are African American. 42% of the deaths are African American in Illinois. Next slide. North Carolina, a little better picture. We have 22% of the population. African Americans make up 22% of the population in North Carolina. 37% of the COVID cases. However, 22% of the deaths occurring in North Carolina. Next slide. In South Carolina, they did not report the deaths. However, 27% of the population there is African American. 36% of the COVID cases there. Next slide. In Louisiana, 33% of the population is African American. A whopping 70% of the deaths there are African American from COVID. So pretty tough impact there. Some of the contributors that we think are sort of driving these racial disparities are really compounding, and so latent and overt bias in healthcare certainly is a story we keep hearing. We repeat it time and time again. An African American patient shows up to the hospital. They complain of the very same symptoms that maybe a white person or someone else is complaining of, but they're ignored, sit back home, only to come back and be positively diagnosed with COVID and have a much worse outcome. Communities of color have higher rates of uninsured, often isolated from healthcare centers. Lack of access to this healthcare really compounds and creates higher rates of chronic diseases such as asthma, hypertension, and heart disease. And finally, Black and Latinx workers are much more likely to have jobs that put them at greater risk for exposure to COVID-19. The EPI did a study earlier last month that said that only 20% of Black workers can work from home compared to 30% of white workers. And I have family members, and I'd be very interested to see sort of the crosstabs to see how that is broken down by age, because I have older family members who are from rural North Carolina who are kind of stuck in certain industries, don't have very much opportunity to do different things. So yeah, I think those are the drivers. There's just some of the drivers that certainly contribute to the disparity and the impact, racial impact we see with regard to COVID-19. Move on to unemployment, and sorry I'm moving through, I want to be very respectful of your time. On March 17th, the governor issued Executive Order 118, which created significant flexibility for unemployment benefits. It removed the 1-week waiting period typically required before someone who lost a job can apply for benefits. Those unemployed and seeking benefits will not have to seek additional work during the outbreak for obvious reasons. We're practicing social distancing, and it doesn't make a lot of sense for folks to get out there and exacerbate the situation with transmission. Employees who lose their job or in certain cases have their hours reduced because of COVID are eligible to apply for benefits, and businesses with workers seeking unemployment will not have losses counted against them. So those are some of the things that Executive Order 118 sort of relaxed with regard to unemployment benefits. Next slide. All right, and the CARES Act, which was passed, seems like 3 years ago, but I think it was last week, or the week before last, was a significant expansion in unemployment benefits. It gave eligibility to independent contractor, Uber drivers, gig workers, things of that nature. Those benefits expire at the end of this year. It provided a much more increased benefits, a federal supplement of $600. That expires in the end of July 31st. And increased the maximum number of weeks of benefits effective beginning of this year and going to the end of this year. It gives us 13 weeks after our North Carolina poultry sum of 12 weeks. And then actually after those 13 weeks are exhausted, workers can apply for 14 more weeks, which would give them a total of 39 weeks of unemployment benefits. This is incredible because these benefits and expansions are incredible given our General Assembly's decision to cut unemployment benefits in 2013 to a maximum allowance of $350 for 12 weeks. It just doesn't make sense, and it doesn't suit the needs of North Carolinian workers. So last slide. So we have some recommendations. We believe that we should allow attached claims to be filed by employers. We should change the calculation of weekly benefits. We should also increase the maximum benefit amount from $350 a week, as I mentioned earlier. That simply is not enough to take care of a family should one lose benefits, lose their job. And we should obviously increase the maximum duration of benefits from 12 weeks, expanding it much broader. In states like Georgia, Kansas, and Michigan, they've increased their unemployment duration weekly period to 26 weeks. Lots of room for improvement. We've obviously taken steps in the right direction. Obviously, we wish it didn't take a pandemic for this to come to fruition, but we will hopefully take this momentum and move our unemployment system to a much more comprehensive and beneficial system. So with that, I'm happy to take any questions or sort of move however the agenda needs to move at this point. But thank you.
Thank you, Will. I know we said we was probably likely stop around 7:30. I think we can go if people agree. You can stay on till 7:45. If you have to jump off, we understand. But any questions for Will at this time? And also recognize we can try to get questions answered later that we didn't get to.
Exactly, that's what I was just going to say. We have in our records who asked the questions, so whatever questions haven't been answered, I will do my best to follow up and get those to folks. One question is, do self-employed people need to have a 2019 tax return filed to prove income for eligibility? Will they be eligible for state or only for the $600?
It is my understanding that if they have 2018 tax records, that the Department of Employment Security will work with them. That is my understanding. I certainly would suggest them to make contact with the department and try to initiate a claim.
Okay. There were a few others that I sent. Do we know how much money North Carolina will be getting from the federal government? I know $150 billion has been allocated. Do we know how that money will likely be spent?
Yeah, there's a ton of money that's certainly being worked out. For example, we're looking at getting $831 million for education stabilization, for the FMAP increase anywhere from $800 to $900 million. So there's not really, it's still being worked out how much, the total amount of money each state gets. but the CARES Act obviously is going to is trying to do a lot of things and try to create a lot of support for state, from unemployment to administration support. There's money coming down to support the unemployment systems all across the country. We're obviously creating support for small businesses, for hospitals. Not nearly enough money, but certainly a start. I think we're probably in queue for several other stimuluses. This disaster is unprecedented in a lot of different ways, and so while we don't have a concrete number, it's a lot of money is still being worked out. But the range of support is broad, and we should certainly continue if there are things, and obviously this is all moving incredibly quickly. If there are things that you notice that are not being addressed by the stimulus packages or by executive order, we encourage you to contact your General Assembly member, your congressperson, your senator, to make those policy recommendations, or contact one of us, and we'll be happy to work as well.
Wonderful. If Representative Cunningham is still on the line, I have one more question for her.
Thank you, Will.
Come on.
Wonderful. The question is, behavioral health care providers are already facing hardship consequences that are affecting sustainability of service during this COVID-19 pandemic. How is the state working toward a resolution to eliminate delayed payments to providers for teleservices? If behavioral health services decrease due to sustainability issues, members in need of these services will then have to access hospitals that are already overwhelmed.
Well, as you all probably have heard me talk about mental health, that we have been in a mental health crisis in the state of North Carolina for years. So the COVID-19 has actually made it worse. The only options now is telehealth, telepsychiatry, to stay engaged. And I know that the LMEs and the MCOs have been given guidelines, and some of the home visits have been contained because they no longer can go in for intensive home visits for some of the individuals. The guidelines have been set by the Department of Health and Human Services, and the LMEs and the MCOs still are responsible for providing those services and providing them in a safe manner. So they're still out there. The issue with the payment, that has been an issue for a while. And like I just said about mental health, now this issue is mounted again with providers. So there's going to have to be a lot of significant changes that take place. We're trying to save lives and we're trying to save minds, but we haven't done the investment in mental health like we should have. And now we're finding that we haven't done an investment in public health like we should have. So it's a double-edged sword, but we're still looking for the Department of Health and Human Services, the LMEs and the MCOs to do what they're supposed to do for the mental health system. I know they have done some containment in congregate settings, in group homes. They know what to do to prevent the spread, but as far as the provider getting their money like they're supposed to from the state, that's always been a slow process. And I can imagine now with the transition to telehealth and telepsychiatry and everybody trying to learn what they need to do in order to get those proceeds that are owed them, it's a difficult transition for everybody. So we're still in a state of emergency, but we always have been in a state of crisis for mental health.
Thank you. I think that is, well, there's one more. What support will there be for Black women who can't get childcare and employers are telling them that they have to come to work or they will not have a job?
Oh, wow. Now that's a hard question. And I'm sure that's not just Black women, but you have a lot of essential workers who are African Americans or minorities that are doing some of the heavy lifting right now as far as feeding our children and working in daycares and sweeping the floors and working in supermarkets and driving trucks. So that those essential workers are African Americans most likely based on the statistics. But to say that, if you don't come to work because, you know, you're an essential worker, I think you're going to have to take that look at yourself and say, am I healthy enough to be in that environment? And then looking at, am I able to supply shelter, keeping food on the table? They deal with a multiplicity of issues. And so, you know, those are difficult decisions. But as far as the employer, you have to, if you have to write a letter or confront them, you could end up becoming unemployed. But at least, you know, you're trying to preserve your own life and your status and children's lives. But you know, that's difficult because I'm not that person. I've been that person that have had to make that decision between do I work or put food on the table. I've been that person. But it's a lot more people out there now that are having that experience, and I could dare not say that I know how to walk in their shoes right now.
Wow,
Thank
that,
you.
thank you. Thank you so much. I think that's a tough question. I would maybe add to, I think it's nc211.org. And so that site is supposed to be consistently updated on resources. And it may be that a question for your local legal aid of North Carolina office. I'm really sorry to hear that those might be two places to start. So I know we're at 7:46. I want to be respectful of your time. So I'm just going to be very quickly and tell you on behalf of the health advocacy team at the NC Justice Center, thank you. Thank you for everyone for participating and sticking out with us this evening to learn more about the policy implications to our health and our economy and our state and to our peace of mind. And I want to say thank you so much to our featured speakers tonight. It was just really another great event that we have put on because of all of you and your participation, but also this incredible team here. So Hun and Rebecca, and with this concept, and Hun and Will working on slides, and you know, Will doing this presentation on race equity, and Rebecca teaching us all how to become experts on GoToWebinar. And just thank you so much to the team. I wanted to say have a good night and everyone stay in touch and stay well, and join us for the next event that we have. If I left anyone out, charge it to my my mind, not my heart. And thank you so much and have a good night.
One last thing, you will be getting a recorded version. You will get this presentation recorded in your mailbox probably tomorrow.
Thank you, Rebecca. Thank you so much for moving us through. Thank you for doing the slides also, Hun. Have a good night, everyone.
Good night.
Good night. Thank you.
Thank you.